The World Health Organization has admitted there's a big unknown about how many coronavirus infections are caused by people who don't have symptoms of the disease, what are called asymptomatic cases. One of its scientists had suggested it was rare for the virus to be spread this way, but the organization now says up to 40% of infections could come from people who have no sign of being ill, and that could make the virus harder to stop, as our science editor David Shukman reports.
This is a message from the government's chief medical officer about coronavirus.
If you or anyone in your house...
For months, government advice has focused on symptoms, how you must isolate if you get them.
You should all stay at home.
But what about people who don't look as if they have the disease but are still carrying the virus? Like paramedic Chelsea Mason, who had a test for coronavirus and expected to be clear.
I felt absolutely fine. Came into work and had the test done, and then a couple of days later I got a call back saying it was positive, so really shocked because I had no symptoms whatsoever.
So how many cases are there without symptoms? A study at Addenbrooke's Hospital in Cambridge found that 3% of the staff were positive but didn't show it. In the US, at a care home in Washington State, the numbers were higher. 56% of people with the virus had no indication of being ill. And on the Diamond Princess, a cruise ship off Japan, as many as 72% of positive cases showed no symptoms at all. So why does it matter if people have the infection but don't have any symptoms? Well, for two reasons. First, if someone becomes infected, it may take 5 days before they show any signs of illness. But for the 48 hours before their symptoms start, they could be passing the virus on. Then there's the category of people who catch the virus and at no stage have any symptoms at all, maybe for 10 days or more, no one really knows. And scientists are desperate to find out how much they can spread the virus.
One of the first things I thought about really was, oh my God, I've done 2 night shifts. I've come into contact with, 6 or 7 patients per night. I've been with my crewmate for 12 hours. As much as we minimise the risk, that there is still that risk there. And with me being positive and not knowing about it, I could have passed it on.
Yeah, so just lower your window for me and I'll pass the test through to you.
Working out if that's going on now is really difficult. The government is mainly testing people who may have symptoms. Those who don't might slip through the net. So scientists in Norwich want to test the entire city. 100,000 people. They say it's the only way to discover who's spreading the virus.
If you don't realise you're ill, as we come out of lockdown and people are going to have more contacts than they did previously, the risk from those individuals is likely to increase.
The upshot is that keeping a safe distance still matters. And where you can't, governments around the world are recommending face coverings, in case you've got the virus and don't know it. David Shukman, BBC News.